Ladies and gentlemen, welcome back to a special episode of the Healthcare Trailblazers podcast. Excited to be sitting here today with someone that deserves a massive congratulations. This is Sean Duffy. Sean is the founder and CEO, or co-founder and CEO of Omada. Is it pronounced?
That's correct. Yep, you got it.
Omada Health, and Omada just announced this really incredible deal with Amazon, which is obviously an exciting proposition for any entrepreneur and any founder. And so, obviously, I'm sure an equal congratulations goes to Amazon, but would love to hear all about it. So, Sean, thank you so much for joining us today.
Yeah, happy to be here, and thanks for helping to kind of spread the news.
Absolutely, really exciting seeing it, all across everywhere. So excited to keep that buzz going. So, tell us a little bit about yourself and how you got involved in healthcare.
Yeah, for sure. So, I'm Sean Duffy, co-founder and CEO of Omada Health. Just kind of really quickly, Omada is a virtual care company. We support our members that have either prediabetes or challenges with weight, diabetes, hypertension, musculoskeletal care, and we describe ourselves as a between visit care provider. And so that kind of speaks to the background and story. So I studied neuroscience in undergrad, always kind of loved computers at heart. Ended up working at Google for a couple of years and went off to medical school, was enrolled in an MD MBA program at Harvard where I started Omada. And kind of the question we asked is, how might you build a more evidence-based digital health company? And then what are the care areas where that day-to-day support really matters? So that led to, our start in the metabolic space. And that's rest is history from there.
So you're working at Google as what?
It's funny. So I was in this group called People Analytics, which was an organizational psychology group. So I studied neuroscience and behavior in undergrad. And because I could get into R and analyze data, though I couldn't, program, Google was open-minded to, having me there, which was great.
But that wasn't enough for you, so you went to medical school. So you went to Harvard Medical School?
Well, it's funny. So I thought I had to pick tech or healthcare, truth
Okay.
be told. And, I remember it was 2006. At night, I'd be reading Slashdot, so kind of yesterday's Hacker News. And I'd see my biochem textbook just kind of sitting there next to me, asking me to open it, but me not responding. So I was like, well, I gotta choose. So and then quickly I realized once I was at Google that you could combine the worlds. And so that's what I ended up doing.
That's really cool. Yeah. And it's, there's a big issue with health tech, which is that a lot of times you have tech people that are trying to do healthcare and they don't really understand the end user. And they don't really understand, they're coming from the technology space.
Yeah.
So it seems like you're the perfect fusion. But just to throw the question at you, do you consider yourself a health person that does technology or a tech guy that's doing healthcare?
I think a little bit more of a health person that does technology, but to be honest, I'd put the balance like, 55, 45. It's, I'm always the first one to buy every gadget that comes out to like, just, when a new tech property comes out, register Sean Duffy. So it's like, but you're spot on. I mean, the challenge back then, and I think to some extent it still holds, is healthcare is just extraordinarily complicated. And, it's, that's just a truth. So there's no way around that. And it can be hard for technologists who haven't lived in that world, sat in the shoes of a clinician, understood how the markets work to build in technology. And then, vice versa on the healthcare side. At the end of the day, you have to be able to build an organization that attracts, extraordinary design and engineering talent. And that's difficult if you don't have empathy for the skill sets, know their language, able to shape an organization that allows them to ship incredible products and experiences. And so Omada's job number one, and my job number one, is to bring talents from both sides together.
Incredible. So, you said, did I hear you say that you started Omada while you were in medical school?
That's correct. Yep. Never finished. I asked the dean for a year off and they let me have it. And I asked the dean for 2 and they let me have it. And the bartender cut me dry at 3. And so I just kept going with Omada.
That's amazing. So, all right, so let's jump right into Omada. What is it? What does it do?
Yeah. So, I shared care areas are prediabetes and weight, diabetes, hypertension, musculoskeletal. Just to kind of give an illustration, let's imagine you have diabetes, hypertension, maybe you're overweight. You may hear about Omada from benefits communication, an outreach from us, maybe even in some instances more recently, your provider. You sign up. We step 1, ship you a set of connected devices. So we'll get you a cellular connected scale, a blood pressure cuff, a glucometer, a CGM is indicated. These devices just work out of box. So you step on your scale, there's a push notification. It says your scale's connected. Then we pair you with a care team. So in that instance, you'd have a diabetes support and education specialist alongside a health coach. Um, they get to know you. They get to know your goals. What you feel has gotten in your way relative to your goals in diabetes, and help kind of set shared objectives. And the software experience that ties the world together includes tracking, community layers, content, resources, goal setting, infrastructure. And the core idea is you don't feel alone. For the first time, you've got someone that's proactively reaching out to you on a day-to-day basis, getting to know you,
Hmm.
and then supporting you longitudinally between visits. So that's kind of the how.
And then are you billing for the, like, is this the traditional remote patient monitoring 99454, 99457 program? Are you billing for it?
No, it's not. So we've never leveraged any of the RPM codes.
Okay.
We are a covered entity, so we do
Okay.
file claims. Funnily enough, ages ago, I took our trials to the AMA, and we got the first ever digital specific CPT code issued,
No
um,
way.
which is kind of a Cat 3 tracking code, but it serves as billing infrastructure.
Okay.
So we'll go to say hi to employers and plans, share the vision, share work covered entity, kind of work with their claims teams to be able to process our claims.
Okay.
But it's a value-based billing model, so it's neat. It's a monthly membership
Nice.
fee that includes the whole scope of services. So all the
So I, as an
devices,
end user, am paying for it. I'm paying a membership fee.
you're not at all. No, either the plan or the employer is paying,
Gotcha. Okay.
um,
Okay. They're the client.
or
Okay.
in the value word, the at-risk provider. So we work, like as an example, we work with Intermountain. So they're of course they have their own plan. They have fully capitated MA. So but the end payer is paying, but the person themselves, it's there's no payment.
That's so awesome. Obviously the central subject of this podcast is value based care, and so I think it's fascinating that you've been able to actually. So first of all, give us like what are some numbers? How many patients are on Omada? What are some of the bragging rights?
Yeah, no, for sure. Yeah, so now we're blessed in that we last year crossed over 1 million members enrolled,
No
which is
way.
yeah, it's pretty cool.
Are
And
you serious?
yeah, no, it's fun because I remember, I mean, just founding the company over 10 years ago, it was just so hard to get to 1,000. It felt like just like yeoman's work to somehow get to 1,000. So that's really cool. And then we now have well over 1,900 employers we work with. If you kind of add up our ASO coverage, our fully insured coverage, our MA coverage,
Mm-hmm.
we have one in 10 commercially insured adults in the U.S.
Mm-hmm.
That have Unomata product, in their medical policy.
That's crazy. That's so crazy to me because I've spoken to dozens and dozens, probably hundreds of visionaries, leaders, policymakers, CEOs around value-based care. And, as much as I believe in it, and I absolutely do, I get the feeling from some people that they're not fully convinced, and there's some people that are very vocal about this, so I'm not saying anything new, but there's some people that are not convinced that it's actually proven to actually lower costs, like to actually make money, basically, when you're taking risk. And if there's a million patients in a value-based care setting using Omada, that says a lot, and that has to say a lot to you in that sale. So, like, what's your opinion on the actual um, sustainability or profitability or ability for value-based care to lower costs because you've been able to do it? So,
Well, I think
please.
no doubt it can. That there's all the things that like people talk about with value-based care, which is like, look, it turns that like MRI machine from a revenue center to a cost center, like all that's true. Um, Fundamentally, though, the thing that people ignore at the provider setting is it's really it unlocks operational flexibility. So it's so silly that the entire and it's not and it's now it's understandable because this is how healthcare evolved, that the entire billing infrastructure of the entire US healthcare system, ranging from the codes, the mental models, the regulations, it's all for like billing for time,
Yep.
or kind of the thing, procedures, etc. But the like that's not how people operate. And so Omada, we've never, because we've always had this like monthly fee that includes of everything what we do. Like as a care team member, I could call you, I could message with you, I could FaceTime. It like doesn't matter. Like we're not shackled with like this specific way of provisioning care to get paid, and so it allows
Yep.
you to just like personalized meet the member need, and that's
Yep.
what you can do if you're a provider under full risk. you're just unshackled relative to like how you engage with
Yep.
someone. And through that, innovation comes up. Like you're like, well, it doesn't make any sense that we're dragging that person in for that thing. Like, why don't we just
Yep.
like see if we can do that one remotely? And so I think that there's enormous promise that it'll continue. The challenge and the purgatory that we've been in as a country is oftentimes as a provider, you'll have some segments of your patients as undervalue contracts,
Mm-hmm.
of which there's a million variants. And then you'll have
Mm-hmm.
some that are fee for service. So how do you
Yep.
change the clinical practice if you're
Mm-hmm.
trying to operate with two care models in
Mm-hmm.
coordination, which is why a lot of the innovation in value-based care has been just for clinics that are just supporting seniors under entire risk because all their operations can be aligned. So we do need the whole country to get there. We've seen how it's, released our ability to deliver care in a way that's concordant with our members' goals. And I hope that happens, for the country over the next decade.
You have no idea how much what you're saying resonates with me. Just on a personal level, it's fantastic, and it's so funny that you mentioned about the time slots because I literally, I mean, I've had multiple people from CMS leadership on the podcast, and I was offline. I was talking with some other teams from CMS that had a lot to do with these regulations. I was laughing with them, like with chronic care management, for example, it's that 20 minute, or even RPM, the traditional RPM is like 20 minutes of care. And I'm like, who at CMS decided that 20 minutes was that magical number that cures patients? Because
Well,
like
why
we
should we
know that
assign
some
it?
patients
Yeah,
need 4 minutes and some patients need 47 minutes and some patients need 3 hours. So like
yeah, yeah.
where did that number come from? And
And
I
minutes
absolutely,
implies synchronicity, which it's like, well, shoot, what if I literally just want a message? Does that count?
yep, yeah, exactly.
um, so it's
I totally,
interesting.
I totally, totally agree with you. And so, practical question for you. So, when there are, let's say, abnormal readings or things that need attention, who do you triage that up to? Is that your own providers, or are you communicating with
Yeah.
the PCP? How does that work? How does the
So
relationship
Omada's,
flow?
yeah. So our care team, doesn't consist of like MDs, NPs, et cetera. It's folks like certified diabetes care and education specialists, health coaches,
And these are
LCSWs.
Omada employees.
That's correct. Yeah.
Okay.
And so, it depends on the reading. Some are like automated. Like we just heard of, incredible member testimonial come in that like they feel we essentially saved their life because there was a very abnormal hypertension reading and our system just said, go to the ER.
Wow.
But you'll as a care team member, you'll wake up, within the Omada care team platform to an organized inbox and clinical alerts always come up at the top of things. We're like, you maybe should talk to this person about it.
Mm-hmm.
We will oftentimes, direct to the medical home. Omada's belief system is that we're not out to replace primary care.
Of course.
You're not going to see us launch a virtual primary care offering or general
Yep.
telemedicine offering. Like our job is to say, do you have like a version of how you view primary care, and try to like support,
Yep.
directing to the medical home.
Yep.
So that in something we're like, we just notice that there needs to be secondary intervention. That's what we'll usually do.
Got it. But is okay. But and obviously you're not trying to replace the PCP. But is there any connection? Is there any connection between Omada's team and the PCP that's necessary, or you've built it in a way that if you can communicate, great. If not, not. Like what is that crossover, if any?
Yeah, so it's a spectrum. So we've got our kind of bread and butter employer deployment where,
Okay.
maybe as a person you hear about us through your benefits newsletter comms that Omada's put out within your population. But
Okay.
then we have folks
And in
like me
that
that work.
scenario, sorry, but in that scenario, I basically look to Omada for this specific part of my health, essentially.
Yeah, that's right. So you may have
Yeah. Okay.
diabetes and you sign up. Now what we do is enable you to very quickly export kind of a summarized report that's tailored toward a
Hmm.
primary care audience. And kind of bring that in. And in fact, in a recent survey, like way more of our members are doing that than even I expected,
Wow.
which was neat. Now we of course we can eFax. We also can push to all the HIEs, so that covers a broad swath of the EMRs, and I mean we're a covered entity, so it allows kind of data flexibility. But on the more provider forward deployments like an Intermountain, it's tightly coordinated. I mean, we work with their case management team. We're doing like patient portal messages to reach out to their patients, all
Gotcha.
that. We're just kind of more part of care, and it's a big area where I spend a lot of my time because I don't want Omada's legacy to be like, wow, Omada supported 10,000 or 10 million, 20 million, 50 million people completely sidecar to
Hmm.
their primary care infrastructure versus, allowing Omada to serve as a complement to what is
Hmm.
a really ailing system that has all sorts of challenges right now.
That's for sure. I think that's one thing that everyone from all parts of the spectrum can agree on. So walk me through this Amazon deal. What was just announced, and if you can give us some behind the scenes on how that happened.
Yeah, for sure. So it's really neat, and it's been just really a blessing to watch the teams at Omada and Amazon work together, over the last year and a half, on this. For Omada, about a year or two ago, I found my head starting to flip in how I viewed where we fit into the country. Whereas I'd be at a restaurant and I'd be like, shoot, looking around, I'm like, about 1 in 10 of these people have us as a benefit. I'd be walking down the street. I'm like, you probably have Omada. You might have Omada.
That's
um,
crazy.
and so I'm like, but the issue is sometimes people don't know about it. Like despite our best attempts, maybe they didn't see our communications, or they were too busy to look at it, or my gosh, maybe we ended up at the fourth bullet of a benefits newsletter. So there's just so many millions of people in the country now that actually have Omada that could benefit from it that just don't know it. And so the idea between our organizations is like, what if they're literally doing a search for like a blood pressure cuff or a scale on Amazon, or a glucometer? Like they may actually have Omada. And not only does that include a connected device, but a care services layer that probably accomplishes what they want, which is to get healthier.
And I'm sorry, but when you say they have Omada, you mean they have the benefit of Omada, but they haven't utilized it. They didn't
Correct.
actually get the scale. Okay.
Correct. Exactly. They haven't utilized it. So it's we've kind of stitched our technology systems together such that within the Amazon app, the Amazon actual kind of shopping experience,
Yeah.
you can quickly find out if you've got Omada or you don't.
That's okay. So I'm a user. I'm like, you know what? I'd love to get a scale to start. So I go on Amazon. I start searching for a digital scale, and this thing will pop up saying, "See if you're actually eligible for a Omada scale, because then you'll get it for free." And then
And
I
get the
click
whole
that.
care components on top. Exactly. Yep.
Wow, that's awesome.
Yeah. So it's really
That's
cool,
really
and
cool.
it's a new way. And what I love about it too, it's like, my gosh, why wouldn't you want Amazon to be aware of your benefits design? Like,
Absolutely,
when you're
absolutely.
shopping on Amazon, if you're buying a windshield wiper, you enter the make and model of your car, and then now all of a sudden your shopping experience is contextual to like
Hmm.
that level of personalization. Like
Hmm.
that's kind of a great thing for the world and a good contribution to society.
Hmm. Now, it would seem to me this kind of speaks to a larger philosophy that I have, and I've talked to a lot of people about. It would seem to me that you have a lot more flexibility because you're working in the value-based care space, and it seems like your primary. Uh, are there any government dollars ending up in Omada services, or is it all it's all employers plans,
We
right?
do some work with Medicare Advantage, so that's kind of where that can manifest.
Okay.
Indirectly, and then the Medicare Advantage work can either be with the plan directly,
Mm-hmm.
who chooses to take part of their capitation and give it to Amada because they see the value, or actually the employer, where if the employer either has their own the provider, if the provider either has their own MA plan,
Mm-hmm.
or they're working with a Humana or otherwise under a full cap arrangement,
Mm-hmm.
that provider ends up being the customer, under their capitation.
Gotcha. Okay, so I'm going to ask you this question with the context of, and this is purely my opinion that I'm exploring. Okay, I'm a young guy. I don't have to have definitive opinions. That this is my exploration recently. I think HIPAA's a scam. Okay,
Really marketing.
we'll start there. Um,
Yeah.
I think that HIPAA was sold to the public as this magical thing that's going to protect you from anybody seeing your data. And I think that what it actually is a Trojan horse for large companies that actually own the data to keep it locked up. Because, there's still breaches in data that happen under HIPAA, and they're
Yeah.
relatively, I wouldn't say they're super common, but they're definitely common in any case that you would point to about somebody. But on the flip side, the regular, like, for example, if you were texting your spouse, right, and I got those messages and posted them on the internet, it's a crime, invasion of privacy. Like, that's a problem, and any messaging system will take the precaution so that I cannot do that. All my WhatsApps, all my texts are all encrypted. Like, everything's encrypted these days. Everything's right. And yet that level of crime and encryption does not take away from the ease of me being able to communicate, right, with my spouse.
Mhm,
And
mhm.
so I feel like I also think that there's been a huge generational shift in the mindset around this. I mean, our parents' age even, and definitely our grandparents would never put a credit card in the internet, and they wouldn't do anything like that. And today, everything that we do, like we are willing to sacrifice our privacy of data for convenience. We're just used to that, right? And so, like to me, it's like, listen, the Russians have my social. They have my credit cards. They have whatever. Like, do I actually care if I have
Yeah.
onset diabetes and they know about it? Like, do I really care about that? And I think that if you ask pretty much everyone 40 years and younger if they would sign away from HIPAA for a trade-off of a level of care that you would a level of convenience in care that you would expect from 2024, I think that obviously, unless they're under this guise of like, oh no, then you're gonna like Google me and see my medical chart, which obviously is not the case. I think everybody would sign that deal. And so, and so, purely my opinion, not
Yeah.
not 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 projecting this on you at all, but within the context of that, it seems like you are able to make some tremendous strides in convenience of care. Like even you talking about this seems to me to be outside of the typical lines that most people feel restricted by. Like, yes, you would expect that Amazon should have a connection with Omada. That makes perfect sense to me as a 26-year-old in
Yeah.
2024. That makes perfect sense to me. But I feel like that's coloring. I feel like that's you seem less restricted than most people I talk to. I'd love. I don't know.
I love the provocation, and I think what you're describing, if you unpack it, is kind of a general frustration that folks tend to feel relative to what their experience is in the care ecosystem. I think I'm a little bit less critical of HIPAA than that, and I'll kind of share why. And actually, just kind of tee up, you should as a fast follow, bring onto the podcast Omada's chief privacy and regulatory officer.
Love that.
She ran privacy for HHS. I think she's one of the preeminent HIPAA experts in the country.
Would love that.
And there are the crux of what I've heard in the frustration which you're sharing, which is so real, is in my view more about why isn't healthcare more coordinated from a data sharing standpoint, kind of an interoperability standpoint. And in my view, that's less HIPAA and that's more just market incentive structures. Because if you're an EMR manufacturer, you really unfortunately don't have an incentive to open up kind of data sharing, because that increases the chance that one provider can switch to another EMR. So, this is an area where I think regulators have come in. They need to come in, to provide that. We're bit by bit chipping away at that. I think it's taken way too long, far longer than it should. And so that's kind of interop, and HIPAA has complexities that cause confusion. It slows companies like Omada down. It can honestly, even internally and in healthcare innovation, be viewed as a scapegoat. You'll have people be like, oh, well, we just probably can't do that because of HIPAA, when that's actually not always true. Like there are
Okay.
very safe and credible ways to kind of do that. But fundamentally, I think it is important that the spirit of the law is to ensure that, your health data is protected, not sold, et cetera. So, I do think it'd be neat to do like, all right, let's take like a fresh crack at like what HIPAA could look like to better serve the modern era. Like if you just like scrapped all the the laws and rewrote them. But I do think you need data privacy protection, in healthcare, above other spaces.
Yeah, and to be very clear, I agree that you absolutely need data privacy. Once again, I just don't see why it should be any less convenient than me WhatsApping my friend, which is equally. I want the equal amount of data privacy there.
Yeah, you should have kind of the dashboard of what you're comfortable with. I mean, that's kind of a
Yeah.
cool provocation. It's like, look,
Yeah.
here's what I don't care about. Here's what I care about.
Yep. Yep. Yep.
There's like there's kind of a really cool way to,
Yeah.
kind of
And
to
the other thing that I think that you kind of seem to have the mindset around, which is a huge paradigm shift for the space, is around the way that the healthcare system works. It feels like is that the system owns my health data, and I have to beg them to send a chart to this other specialist, and I have to get on the phone and spend 4 weeks trying to do. And the mindset of why shouldn't I own this? Also, by the way, I think speaks to the ability
yeah.
for people to start being accountable over their own health. But the idea of me owning my healthcare, it seems like Omada's mindset is a lot more in that vein, because the idea of me logging into my Amazon account and being able to check my my data from based on my interest in doing so, on my initiative, makes a lot of sense to me.
Yeah, well, and for clarity, we're just checking your coverage eligibility. So at that point, all you're doing is calling, Amazon after you enter your information is calling our eligibility servers and then returning, are you a fit or not or covered?
Yep.
And then, after you enter our front doors of our clinic, if you will, then all of a sudden we cover, are you clinically eligible, kind of et cetera. So, and you kind of become part of our,
Right.
care track. So uh, but yeah, so that's kind of the core operating relationship.
Yeah. No, it's awesome. I'm just saying it would look very different if I had to call
Yeah.
my benefits
Oh my God.
manager to check
Well,
if Omada matched up. You know what I
yeah.
mean?
Well, it's funny. Like a lot of people don't realize this, and these numbers are rough, but roughly half of the providers in the country, when you walk in and you sign the notice of privacy practices, if you actually read the data terms, you actually do own the data. 50%. That's how Omada structures it. Our members actually own their data. I mean, we have to like license to use it because we need to like
Hmm.
perform
Of
our care
course.
services.
Yeah.
But it doesn't feel like that, and the healthcare system should feel like that, which
Yeah.
is kind of the unfortunate truth.
Yeah. 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 So what does the future of what are your future goals? This is obviously a huge milestone. And again, like kudos to you. You know, one other thing I want to touch on. You've done something, and I'd love to figure out what it is. You've done something to differentiate yourself as a company. At the end of the day, there's a dime a dozen, remote patient monitoring companies out there. Perhaps, the fact that you're strictly value-based care makes yourself different. But I think the fact that you've managed to be only value-based care is really interesting as well, because most people don't end up, being able to cross over there and convincing people enough of the value prop in paying for such a service. So what in your mind, what is that differentiator? How is Omada different that you've grown to become such a great player in the space, and then being picked up by Amazon is obviously a huge deal.
I think it's fundamentally it starts with the founding goal of kind of me asking, well, how could I pass the medical director test, in kind of a what would I need to do to convince my critical medical school classmates that this is kind of the solution's worth its salt? And I was pretty naive when I founded Omada. I mean, I like Omada's ascent. I worked at Google, but I was an individual contributor. Like prior to Omada, I'd never hired anybody. I didn't know what a venture capitalist was. I actually didn't even know what like a self-insured employer was, or
Mm-hmm.
but I could read a clinical trial. And I think what we did right was um, just assume we're the underdogs in healthcare and recognize that we're going to have to publish, recognize that digital health needed to be based on, evidence-based protocols, recognize that yes, yesterday, maybe the NCQA didn't accredit organizations like ours, but maybe tomorrow we could have the partnership conversation because you need to be able to show up to the market, not imagining that it's going to be a different market, but just to meet it where it is. And then things like the CPT code, just well, shoot, can't rewrite the entire billing infrastructure of the US. So how do you fit within it? So like the entire journey of Omada has been that like scene on Apollo 13 where you got to like, take that square CO2 cartridges and get it around whole with the parts in the ship before you run out of oxygen. And I think the determination to study the details and work to do it kind of thoughtfully and just in a way that kind of has substance is honestly, it sounds silly, but I think at the end of the day, like every year that's kind of differentiated the business. And, I had somebody tell me like, look, you're long haul Duffy. And I took that as a compliment because it's like, look, like uh, we want this company to have an impact over many, many decades. And so that orientation has been helpful for the business.
Yeah. What was your? You don't have to share if if you don't want to, but I think it's really inspirational for founders to see where you're at now, and the fact that were, I mean, you were the underdog. Nobody, no new company starts off as the especially
Yeah.
if they're starting from the ground
Yeah.
up. So you definitely were. Was there like a really low point in the startup journey that you felt that now you can look back on and laugh at?
Oh, well, I mean, there always are. There's so many. It's like, I mean, especially in the early days when you're just starting. Like, the way I tend to describe it to other entrepreneurs who ask what it's like is, the as you grow a company, something's always like trying to kill your baby here, like in your, but the frequency upon which that happens elongates. So, like right out of the chute, when you found a company, like every month you're facing something that's existential. it's that key talent that like, oh my gosh, you desperately needed, but they chose to not join you, or another key talent that quits, or like, or a
Wow.
customer that you know that if it flips, you can fundraise on it, but if it doesn't, you can't. Like it's
Yeah.
and every single one of those and more have happened to Omada and every other company. I think that's like persisted. So it goes from 1 month, and then you get some scale, and then every like quarter, and then maybe every 6 months, and every year, and then every couple of years, and then the end state is like a Google where it's like maybe every decade something becomes existential, like generative AI.
Yep.
So
Yep.
um, that's the experience, and two things bring you through those. One is the people you're with, and just having founders and teammates where it's just like fun to work with them. And actually, you asked me what are my favorite moments at Omada. Weirdly, it's all the things that like almost like got us. And at that moment, though, it's extraordinarily stressful. Like you find yourself just kind of like still laughing
Yeah.
because it's like almost so bad it's funny, and you're like, well, let's just try. And I don't know. It's like those are really fun moments, and you've been in the trenches together, as painful as they are in like that minute. When you get beyond them, you just feel ever more proud of them. So it's the people, and then it's just you have to abstract yourself from it a little bit. Like I still remember our very first conversations, sitting in the homes of people with prediabetes, with diabetes, and in like Georgia, and kind of asking what care felt like for them, and you just get conviction, and you get conviction in a way that you're able to detach your self identity with the business, and kind of abstract yourself and say like, look, this clearly is a clinical challenge that like as a citizen of the globe, like one would want someone to step up to the plate and swing at.
Hmm.
And you ask the like, well, should someone give it a go and be ambitious here, and like it's such an obvious yes, and then it allows you to feel like, look, just go, and you're not like, oh my gosh, if the thing just hit a wall tomorrow, like you still feel like someone should give this a go, and you need that like that something, a purpose needs to pull you, because that like gives you the determination, especially in enterprise healthcare, which is like the double black diamond of entrepreneurship.
Yep.
That purpose can pull you through the difficulties.
Incredible. What is the, so now let's move on to the future. What does the future look like for Omada? This is obviously a huge break. A lot more people are going to know the name Omada, what the services entail. What are some of these goals?
Yeah, I mean, it's pretty simple. Like we're very happy with the care areas we're in, and now it's just about ensuring that every single day we're innovating those. Innovating the care models, innovating the way that there's connectivity in the U.S. healthcare system.
Hmm.
And but most importantly, like just continuing to reach for scale. I often kind of say that you add up the people we've helped, our entire competitive set, and like and it's such a tiny drop in the bucket of what needs to be done in chronic and in MSK, that we haven't made any sort of a difference yet. So I think we're proud that we've crossed cumulative 1 million enrollments, but we got to go to 10 million, then we got to go to 20, and then we got to go to 50. So we're staying ambitious, because I would say to the company, like, we got to have tomorrow's epidemiologists notice a bend in the curves and be like, what the heck happened? Like, how's that
Yeah.
possible? And the answer has to be in part Omada.
I love that. It's absolutely incredible. Well, Sean, congratulations again. Excited to continue to watch your journey. You're obviously a very purpose-driven CEO, and so it's really cool to see when people that started from the ground floor and started, scrappy entrepreneurial personality, and then start really hitting these rungs on the ladder. So really excited to continue to watch the journey. Best of luck, and thank you so much for spending time today.
Yeah, wonderful honor to be on, and had a fun conversation. So thank you so much.
Awesome. Let me just hit stop on the recording.